Megan Motzinger, and I'm highly allergic to surface conversations. So let's dig deep. Together, we'll explore creating meaningful habits, deepening our relationships, and cultivating more hope for a better inner and outer life. This is the PS We Expire podcast. I'm so glad you're here.
I actually live in deep South Texas. I married my high school sweetheart, so we were married very young. We're going to be married 20 years this year. And the first couple years of our marriage, I was actually in pharmacy school. So I'm a clinical pharmacist. I have a doctorate in pharmacy. And walking the stage, I was pregnant with my first baby, a little girl. And she is kind of where all of this story starts. And when she was, I would say about two, we started noticing a lot of delays. You know, it's that typical story of most special needs moms. Usually around that age, they, especially when they start going to daycare and being around other kids, it's a lot of this, unintentional comparison, to other kids and how they're learning and how they see life and how they're experiencing life and how they're experiencing their relationship with you. And so over the course of those years, it took till about 5 or 6, because she didn't present in a very clear way for most diagnoses, but eventually autism was added to her diagnosis list, and then intellectual disability when she was about 6 or 7, I would say. And then speech delay and ADHD and, the alphabet soup kept growing. And so we've actually been quote unquote disability family, or, had somebody with disabilities in our family for, almost our entire marriage, my entire parent, life as a parent. But during that time, once I realized, not necessarily how difficult, but I guess how challenging life would be for her just because of her diagnosis. And remember, this was autism at that time. Autism was the main diagnosis that we were finding challenges in. This was also many years ago. She's 16 now. So imagine 14 years ago, autism is now becoming a little bit more understood and even celebrated on a lot of different, platforms, and where differences are being accepted and diversities, being definitely celebrated a lot more. Back then was not like that, especially in a small town where nobody really understands. You don't have a lot of resources, and that's not understood. And so that's about where I threw myself into advocacy. I like to say it was kind of forced advocacy, I guess you could say, right? I don't like. It's difficult when people are like, oh, it takes such a big heart for people to go and advocate for others. Mine was out of necessity. And this was out of just trying to figure out, how to be a mom to this little girl and how to help her maneuver a world that already was placing so much stigma on her, and that already was misunderstanding her and was already limiting opportunities for her, So advocacy for me looked like writing. I wrote a book, I wrote blogs, I started nonprofit organizations where I could gather other moms like me just to have conversations about this, because I felt so alone. It was, again, really not for them. It was for me, just to find community and figure out what we needed. Because I was so, at the time, in the beginning, the word is devastated, which now takes on a whole new meaning for me. But back then, right, that was devastating to me. And I think there's so much shame and guilt sometimes that comes with even saying that. How could you be devastated? This is your child. You should accept them however they are. And that kind of language that moms are given a lot. And I didn't feel that way. And so I struggled, and I tried to find community that could equally feel the way I did, but then equally tell me, how are you now, right? As your children are older, and to be able to feed off of others and learn from others too. I like to think that I'm a lifelong learner. That's how I cope with most things in my life, is learning things. Some of my earliest childhood memories are just of me on a bed reading a book. I don't know what generation you fall in, but I'm in the beginning of the millennials. So there was no internet or phones or social media when I was growing up. It was books, and books were the window into everything, and education, not just an academic standpoint, but into the world and people and experiences. And, so being a lifelong learner, I think led me to a lot of those things. It led me into the nonprofit world. It led me into asking to be on stages, to speak to teachers, to speak to schools about compassionate education. I cared very much about special education and why it was not great. Like, what do we need? Everybody kept saying that the system is broken. And I remember keep thinking, like, for it to be broken, it had to have at some point worked well, and it didn't. So this has got to be scrapped. There was a lot of conversation, and I think I desperately wanted to learn. Some people were willing and some were not, but that was that whole first part of her life that was really in that. And then she's 10, and I write a book about each year of her life to kind of, commemorate her 10-year birthday and how much we've changed. I had 2 other children by that point, and so I wanted them to understand why we are the way we are, and why their mom is the way she is. And a big part of it was Isla. I don't know if I've said her name, but Isla is her name. And so then once that was out and the book was out, it opened up a lot more, like I said, for a lot of the other things that I mentioned. And I got caught up, I guess, in connecting people in a way to build friendships and to have conversations. So my focus at that time was, if I can get women in a room to have a conversation, right? Maybe give them a night out, maybe let them have a dance party and a margarita. Maybe they'll make a friend. Maybe they'll make a connection. Maybe they'll be able to find somebody like them that they can go to when things are really difficult. Because a lot of conversations when you have a special needs child are really out there sometimes. It's not the typical things that you talk about with other moms, or with other friends. And so that was the goal at that time. And it was also a time I felt where I was healing a little bit, I felt better about it. I was like, my greatest fear at that time was, what's going to happen when I'm gone? Who could possibly love this little girl the way I do? Who could have the patience that it requires to care for her in this way? And, but definitely a time when it was acceptance, hey, our retirement's going to look different. We're going to have her with us all the time, and let's rethink things and redo things. And we were good. It was like, this was our new normal. And we were almost excited for what the future would have and bring. And then she turned 13. And when she was 13, we had, not really an incident, but it was a day when we were at a carnival. She's always loved rides a lot, or every kind of ride you can think of. I think it's the whole proprioceptive, vestibular, sensory thing for her. But she gets off the ride and she can't walk. Literally cannot walk. Almost imagine like stiff knees, wide hips, walking sideways, almost like a crab, when there's just absolutely no coordination, no sense of spatial awareness. It took about 20 minutes, and then she could walk again. And it was like one of her foot was dragging. And so she's 13, and I describe it as one of those moments when you have no idea what's going on, but nothing will ever be the same. It was kind of like that. And I knew it also was not autism, right? Because I'm like, okay, I've done enough deep dives. I've done the education. I've learned this. This was not the progression, that they tell you about. And so that was at that time pretty scary, because I knew we were looking at something different. And so we did all the things, remember I mentioned we're from an area that has very few resources. So we went to Texas Children's in Houston, which were an incredible facility, an incredible group and system. And we we saw a neurologist there. We did an MRI, and it found that almost her entire cerebellum was gone. And it just atrophied, like out of nowhere. And, keep in mind that I'm a healthcare provider. I know a lot about this stuff. During a lot of visits with doctors, it's very easy for me to put on the pharmacist hat and to put on the doctor hat. Right. And so I remember thinking a couple of things when I saw that is number one, nothing explains that in a physical way, right? There was no car accident or, injury, or the cerebellum is such a particular part of the brain. It would even be difficult to damage just that, right? So remember thinking that. I also remember thinking that doesn't just come back. Like, we're not going to just fix whatever this is. This was without even knowing the cause or, what it was. And so I also knew now that all the issues she was having with walking and, motor coordination would continue. And so months later, genetic test comes back, and it showed that she had an ultra rare gene disorder. And ultra rare in the medical world means less than 1 in a million, which is awesome. So that means this lady who has been seeking connection and people and community for years, is now told, sorry, here's this diagnosis. And there's probably no one. There's probably very few people who will even begin to understand what's going on, And so I think with the advances in technology, that's how this gene disorder was discovered, right? Because we had done those tests earlier in her life, obviously MRIs, we'd done it all when she was little. And I think this was just something that they now can find. And so the particular profile that she meets of this gene disorder causes the brain to atrophy progressively, which means she will regress. So we were told then that this was life-threatening, and that the oldest person, again, remember this is so rare, so the oldest person I think was in China somewhere. She had lived into her late 20s, but she had the other profile where they had respiratory. There's a respiratory arm, and then there's a brain, neurological arm. My daughter has the brain that's affected, and so what do you do with that? Like, what do you do with that information? It's almost like it's like an enhanced version of the unknown. Like imagine the unknown is already so difficult and so hard, and right, just as a mom, just with all of your kids, and then to be told something so vague but yet so final. It was such it was a really difficult time, and I think it was also difficult because of who I am and what I do. And there's a lot of expectation when you are, I would say, I don't think it's just a mother in the healthcare field, but maybe a mom. You just had this the other day. I think you just had about the over-functioning, right? Over-functioning partner. When you are a woman that is the go-to, you are the one that fixes things. You are the one that will figure it out. That's a lot of pressure. That's a lot of pressure to hold up for yourself, to hold up for your children, to hold up for your husband, for your parents, her grandparents that love her so much, so it was a lot. And I think for a long time, I tried very hard to just keep the doctor hat on, just the pharmacist hat. We're going to do the things, and we're going to start medication. We're going to do what we need to do to make sure everything's in order. And then things just started crumbling around me physically, with myself, with my body, with the way I felt and the way that I was reacting to just, I don't know, everyday things and relationships and people. I would say that was about that first year after the diagnosis. And so that led me into a really deep dive into mental health, all things mental health. And I think that was what was curious to me, is that I know as a healthcare professional, right? I know what depression is. I know the diagnostic criteria. I know what anxiety is. I know the diagnostic criteria. I know what PTSD, I know I know that. That's what part of my job and part of what we do. I should mention that my job as a clinical pharmacist has nothing to do with dispensing medications. Clinical pharmacists with a doctorate work with patients every day. So I work at the VA. So I work with veterans every single day. And because it's a government facility, the physician can actually give us the authority to manage a certain disease state. So let's say diabetes, for example, he's like, hey, I really need help with this patient. Okay, my scope now is to help him with all things diabetes. I can write medications, change medications, so we have a lot of authority. and autonomy in that space for different disease states. So I've done everything from diabetes, hypertension, hyperlipidemia, which is high blood pressure and high cholesterol, also anticoagulation and blood thinners. So again, I was in a space where, I think I felt the expectation that I needed to know everything about her, but at the same time, fix something about myself because I knew things weren't right. Right. And I knew it wasn't depression, and I didn't know if it was just sadness. Obviously, nobody would argue with the fact that, I could be sad. I didn't know if it was grieving, because grieving felt so complicated and almost shameful because she's still here. Um, there was so much conflicting things. And then I would kind of look up, what I was experiencing and what I was feeling. And then the word trauma would come up. And I would be like, oh gosh, it can't be trauma. It can't be trauma. Because think about who I take care of every day, Morgan. I take care of people that literally saw some of the most excruciating things of their life with people that they cared for, right? These are soldiers who have served. And how could I possibly compare myself, to that, to say that's trauma? So there was this big, big need to not only understand what was happening to me and to my body, but to name it, to tame it. Like I need to know what this is. And, so I made a really big decision it's been a couple of years now. So this was about a year after she was diagnosed. And I realized that things were not getting better. I did try therapy for a few times and had some bad luck with therapists. There's good and bad therapists, just the way it goes. The first few were not so great for me. I didn't have good experiences. And so I decided to become a therapist. That's basically the answer. I don't know. That probably sounds so wild to most people, but I don't know anybody who's had a doctorate and then went back to school, but I honestly didn't know how else that I was going to understand myself from the bottom up. And I knew that that would be necessary for what this journey would bring. I knew that this journey would have a lot of phases and where I would need tools, tangible tools to get through each phase. And I also felt a really big responsibility to learn those tools and have them readily available for my kids. Because now I had siblings. I had 2 children that were watching me handle crisis, that were watching their sister literally regress in a matter of weeks to months into something we didn't even recognize. They were watching our home turn in, with ADA bars, grab bars, shower chairs, toilet seats, caregivers in and out, medication, wheelchairs, walkers. This is in a matter of weeks. They're watching their mom, who's not the same anymore, who cries every time she washes the dishes and seems to be so unhappy. There was just a lot of things changed. And I knew, I felt a responsibility more to them, I think, than to myself, but knew I had to learn it for myself first. So yeah, I'll complete my master's in mental clinical health counseling this year. And so right now I'm working on, accumulating those hours, to finish. And I have a lot of different ideas and dreams about what that will look like and what I think it'll be a very, very different kind of practice, knowing what I know now and what I think is actually helpful to moms, which honestly is not dance parties and mimosas. It's just not. It wasn't enough for me at that time. And so I made a lot of big transitions in my life. I got out of nonprofit work. I had to really focus time and energy and resources into things that would serve me well and into areas and spaces that I knew I would need, for the future. I feel like that's a lot of information. So maybe we want to dive into something else a little more specific. But
Well, we talked a little bit about this lack of basic education in how to handle hard things.
Yeah.
So like you were talking about, like when you have a baby,
Yeah.
you go to classes, you go to Lamaze or you go
Yeah.
to these birth preparation classes at the hospital, and you learn what signals of your body means, and you learn how to take care of yourself in these ways. But there's a major gap in learning and resources for how to deal with hard things, which is silly to think about because, half the population, less than half the population will go through childbirth, but 100% of the population will go through hard things, like whether it's receiving a diagnosis or losing someone you love or getting fired from your job or whatever. So can you talk a little bit about this, like this framework that has started to come together for you when you think about how to deal with hard things?
Yeah, yeah. So I think that, and this has been, again, when all of this happened, and I did find a very good therapist, after some time, um, I began to dive into a lot of different reading. I went back to books, right, which is exactly what I remember, being something that I loved and had a passion for. And so it was a lot of reading, personal experiences of other people. It was also all of the learning that I was doing, right? I was learning so much in school, particularly in development, right? What happens at different stages of our development? How is our brain a little bit different? What do we need? Again, remember my kids, they're also having other issues too. This is not, I think people also misunderstand it. It's tough to have a platform where you're a special needs mom because it's only a part of this huge big life that you lead. And so, yeah, my kids are struggling with my daughter and all of the realities of our home life. But my other daughter just started middle school. That is like a jungle in itself. Like, you know what I mean? Like that's a whole nother. So there was still ways that I knew I could help them, not just with this. It wasn't just about Isla. It was about life in general. And I know what helped me. There were several. Number one, the first thing that helped me was to understand what it actually was, right? And that's when I did find out that what I was experiencing was complex PTSD. And complex PTSD it's a little different than PTSD in that there's no end. There wasn't an event that happened and now it's over and now we need to recover. It is ongoing. It's an ongoing thing. And again, there's a bunch of diagnostic criteria for that, which, is probably a whole different podcast in itself. But a lot of the studies compare, when you talk about complex PTSD, there are studies that compare soldiers to mothers that are caregivers. They compare different mothers who don't have children with disabilities and mothers that have children with severe disabilities, even to the point of changes in cortisol levels and changes in your telomeres. So the telomeres are literally the protective caps of our DNA. So mothers like me would automatically have shortened telomeres. They would be at much greater risk for almost every single disease state and health impairment ever like heard of. And so it literally took years off of your life. So there was just a lot to learn first about what I was actually experiencing and taking away the stigma of comparing, right? And saying that, oh, I can't be going through trauma. There's no way, right? Because I'm not the same as a soldier. I'm whatever. The truth is that my body did not care.
Mm-hmm.
My body did not care if I was a soldier or if I was a mother. It reacted in a way that experienced trauma, period. And I think we can take away a lot of, that's the first step because a lot of us, there's so much stigma and shame just in how we feel to even identify what we're feeling and identify what we're going through is valid and real, regardless of where it is on your severity scale or, who seems to be worse off than the other. That's really the first step. And when you think about it, you can apply that to everything. When my kids come home and they're upset about a bully, my daughter will be the first one. Remember, we're a disability family. So she'll be the first one to say, and I know I shouldn't be mad, Mom. I know I shouldn't care. I know there's bigger things in the world. And that's where we stop it. It's like, wait a minute. There's a saying that's like, the worst trauma is your trauma, right? Like the greatest pain is your pain. We're not going to play that game here of saying so-and-so's better off than me, or I shouldn't feel this way because it's not right. So that's the first step, I think, for me, that I took away. I had to really understand, and I think people research it, and I think good therapists do that almost first, is to really help someone understand that this is a physiological and physical manifestation of a lot that you cannot control. And so it takes away this idea of being weak, or right, not having a lot of mental power, or you're mentally, weak, or you're not tough enough. It takes that away when you understand what the body is doing and why. I'll tell you one quick story. There's so much criteria in complex PTSD that we could go through. I have a whole presentation where we break down every single component and how it presented in my life. And so I love it because it's like the only time when you're going to have, you have a case study presented and the study is presenting the case. It makes for a very dynamic presentation because, you really get to see it in real life, So for example, if you say, that whenever you do have, chronic PTSD, that it can manifest in ways that, are sensory, or like where your emotional dysregulation. Well, what does that mean? If you just say emotional dysregulation, you know what I mean? What does that mean to people? And so one of the ways that presents is through sensory triggers. And this was one of the big ways that I think it not proved to me, because I already knew, I was already kind of understanding that my body was reacting. But one of the biggest challenges, I think, mentally and just from a visual standpoint, that I struggled with as a mom to Isla in this transition of being able-bodied and then not, having this a real physical need for everything in her life, was the switch to diapers again. She was 13. And again, learning to be very independent. And, this was, yes, autism was a factor. So was intellectual disability. But still, we're teaching her skills. She's learning skills. And when incontinence came into our life very quickly after the diagnosis, it was just something I couldn't. I don't think I'm a person that dwells in denial, but I was in denial. I was not going to take that little girl out of panties. I was going to keep her in panties, even if I had to wash every single day, if I had to clean the floors every single day, if I had to wash the bed every single day. I couldn't get myself to use a pull-up or a diaper. I couldn't. It was almost like a physical block. So during that time, I would use Thieves. Thieves is a pretty popular essential oil. I would put it, because I felt like nothing covered. I didn't want her room to smell like Clorox and, Lysol. Everything was becoming so medical. Caregivers would come with a mask, and then you're like, oh, I wanted so much for her life to be, I guess, for the dignity to be preserved, for the, right? Like, nobody wants their room to smell like Clorox and Lysol, so I was mindful of those things. So I got Thieves, and that's what I would use to clean every time there was an accident. Months later, I finally give in, obviously. We get the pull-ups, we get the diapers. That's been still something I don't think you recover from that visual from a mother's standpoint, caring for an adult woman now, right? That's a very strong thing that I still have to work through almost every day. But I happened to be one day, this was months after that happened, okay? Months after we transitioned her to diapers and everything was better for me, but obviously just, a little bit difficult emotionally. And I was in a store with a friend of mine, and it was a candle store. And I smelled a candle, and the candle was Thieves. And I didn't make that connection. I was just like, oh my gosh, this candle smells so good, right? It was just in a place, and I just happened to pick it up. I smelled it. It smelled awesome. And almost immediately I began to sweat. I could feel my back was sweating. I could feel my chest was sweating. My underarms were sweating. I remember shaking a little bit and thinking like, oh my gosh. And I remember at that time thinking like, wasn't that candle? Like maybe I did something wrong. Maybe I wasn't feeling good. I felt super clammy. My heart was racing. I'm like, what is going on? And it was things like that. Where after and again, this is where I used my little 3-point system, which I'll tell you right now. And maybe that's a good place to use it. I used what I had learned about self-awareness and it was self-awareness, self-compassion, and self-reflection. So in that moment, right, my self-awareness told me that I'm safe. There's no reason why I should be, right, there's nothing here that is a threat to me. right now. So whatever my body is feeling, whatever this anxiety is, whatever this stress is, like right now I'm safe. So let's identify what this is, right? But understanding that I'm not in a space where my body, should be reacting in this way. Second part was self-compassion. Self-compassion says you are loved. And that really is more of a testament to you're not alone, right? People love you, they care for you. Also, a lot of people can relate to you. People have been in this position before. People have felt anxiety like this before, that kind of thing. And the third one is self-reflection, which means I need to learn something. I need to, right? Let me go learn something. Let me dive into education. Let me figure out what this is. That was kind of the start of this whole, complex PTSD thing for me. And then I find it in the diagnostic criteria of complex
Hmm.
PTSD, how there's all these sensory triggers that just happen. And if it weren't for that, I don't know if I would have been convinced that it was so, physiological and physical for people. And so, so I use that construct a lot for my kids. And remember, this is more in the mental health space. It's very different if there's a physical danger or, something that's happening where your body has to react in a physical way to avoid something. But for example, the bully, I just told you about the bully situation, right? Let's say with my daughter. Um, in that situation, we go through the 3 steps. Okay, you're obviously upset, right? You're crying and you're mad. This person was so mean. What they said was so rude. It was not, warranted. And so let's first establish the fact that right now that person is not here. Right? Right now we're home and everything is safe. We're having a good meal. We're gonna be right. We're gonna just talk about everything until you feel better. It's this idea of safety, because if we don't feel safe, it's really difficult to have any kind of rational conversation or even rational thought. And so that alone simmers it down, right? It kind of takes it down a notch. Like, okay, I'm not saying your feelings are not valid. They are valid. I would have been mad too. I'm actually probably more mad as your mother than you are, that someone called you that. But let's establish that for right now, right? Self-awareness tells us that right now nothing is a threat to us. So we can have this conversation in safety. That's really important. I think that's so, and that it's such an easy thing to do, depending on where you are and what the mental health issue is or the challenge is. The second part, which is self-compassion, tells us that we're not alone. Okay, you're loved and you're not alone. People all around the world get bullied. Bullying has gone on for years upon years, and it'll continue even when you get to be older lady like me. It continues. We know this, and so self-compassion says you're not by yourself. What you think isolates you connects you even more. And right, you have family that loves you, whatever the bully used, I used against it. I was like, that's actually why we think you're so cool. And that, I think that's an amazing thing. And think about how many people, who would you be without that? It's such a cool part of who you are, and that kind of conversation. So just that alone, we haven't even talked about the bully yet. We haven't talked about where she was or what was going on. We haven't even talked about her feelings yet. Just starting that with the conversation, which leads to self-reflection, which she has to do herself. So now the learning piece is, okay, let's talk about the bully, right? What does that say? What do you think the bully wanted? How do you think they wanted you to react? How do you think that makes them feel? Why would you think that someone, it's all the questions of reflecting of why would they say that? How did that make them feel? What was their intention? How did that make you feel? What are potential ways that you can, what do you do when you're in that situation? What are the options? Because again, then that's the education piece. It's all the learning. Maybe we don't know the answers yet, but we're at least committing to the fact that we're going to be self-reflective. And I think that triad is so important for kids. I wish I knew it really young. I wish I knew that really young, because think about all three of those things start with the word self. This is not about placing blame. This is not about becoming a victim. This is not about saying, he made me feel that way. He made me do that. He is causing this. She is doing this to me. It's all about understanding that we have so much, we have control over some things, and we also play a role in everything, right? So it's not about fault. It's about your role in how you feel and how you can adjust your perspective on a lot of different situations that I think in the end can be helpful in almost every mental health issue or challenge that you go through.
This sounds like a really important thing to do when there are circumstances that you really can't do anything about, that you can't
You're
escape
helpless.
from. Like I'm thinking about your response to the smell of the thieves and the candle. The reality with your daughter isn't something that you can get away from.
Right.
Like with some situations, people will be like, okay, I'm going to get a different job, or I'm going
Yeah.
to, I'm going to find a different friend group or whatever. And I've thought about this a lot in terms of my experience with Annie, that
Mm-hmm.
I, it helped when I really understood that, like, I could quit, I could leave,
Mm-hmm.
but I wasn't willing to do that. That didn't align with my values, that didn't align with who I wanted to be, and that didn't align with how much I love her
Yeah.
and how much I love my
Yeah.
family.
Yeah.
But even just recognizing that small sliver of choice
Mm-hmm.
really changed my perspective in those hard moments where I felt like I don't want to do this anymore. I can't do this anymore.
Yeah.
Because like it just reminded me, like, I am still choosing to be here in this
Right.
really hard thing.
Yeah. Yeah. Um, that's an interesting point that you mentioned. It kind of goes back to the whole, the complex PTSD thing, where there's no escape. There's no escape. It was also difficult for me because when I researched complex PTSD, a lot of complex PTSD was first diagnosed in children who are abused every day. So again, there came to that comparative thing, right? Like, how dare I compare myself, to that? But then when you look at the root of it and the definition, it's when it's when you're in a situation that you cannot escape, you cannot leave. So whatever is causing the trauma, whatever severity you want to call it, or whatever the cause is, it's not going to go away, right? This is going to be ongoing. We don't know how long, we don't know, how bad it'll get, but it will be ongoing. And so, yeah, I think for me, the word healing is such a cliche to me, because
Mm-hmm.
there's not like an endpoint to this. I'm not going to sit here and tell you, oh yes, I've healed from that whole experience. Like, no, that's not the way it goes. This is ongoing. This is ongoing. The work it takes to be a very physical caregiver, a very physical provider in every sense of the word, to an adult, is extremely taxing. It's a lot. And again, but there comes that self-compassion piece that I've learned, and that I have found that it actually connects me so much. We have, the statistics are huge in our country. We have a lot of people caring for people. And it doesn't have to be a child with a disability. It's these parents who have dementia, who have Alzheimer's. A lot of her symptoms in the beginning, before we figured out meds and stuff, were very much like dementia, aggression and violence, and watching somebody you love so much, and it's just not them, it's somebody else trapped in that body. I have found more connection pieces with people who are caregiving for the elderly or the geriatric population, their aging parents, because of that piece, because of that, the reverting back, right, to, again, like me having to go back to
Mm-hmm.
diapers. And so when you look at those numbers, it's like 1 in 6. It's crazy. It's a lot of people in our country that are dealing with that. It's like 1 in 5. I think it's 1 in 5 adults in the US are caregivers. Of the 1 in 5, 68% are women. So now you're talking about a woman's issue, right? I mean, that's a huge majority. And of that 68%, 60 to 70% of those women have jobs, have a full
Mm-hmm.
time job. You know what I mean? So this is not something, like you said, you can't just, people say, yeah, I would devote my whole life to my kids. I would, well, yeah, they also, I mean, bills got to be paid too. And that kid has to eat. And, so there's so many levels of responsibility that also don't wait for you to catch up. They don't wait for your mental health to get a little bit better, So it's a lot to manage at one time, but it's definitely, I think, a growing population of people. I think the need for more, I say support, But even support sounds so generic. Like, what does that look like, right? Because they say, yeah, we need to support the caregivers. Well, what is that?
Hmm.
Is it respite? I mean, yeah, we need rest. That's true. But the truth is, the most help that I've needed is in those nights when I'm sitting next to her bed and I had to clean urine all night long, and maybe the first seizure happened that was so shocking, and I'm in the dark, man. Like I'm alone here. What are the coping mechanisms then? What am I
Yeah.
telling myself then? What am I looking for? That to me is what my passion has been drawn to now, is when we are in those moments, what can we tell ourselves? How do we help ourselves? Because there's no amount of dance parties or margaritas, there's no amount of journaling, there's no amount of gratitude practice that in that moment is going to help me not feel so completely helpless and worthless and angry and mad and shocked, all the things that come in. So that's my next, I think, life's work is to figure out, and I have ways that work for me, right? They again preface this 3-part module where I have to tell myself that this surrounding is safe, because the truth is, in those moments, what's happening in that room between me and her, what I'm experiencing, we are in a safe place. We are in a home that I love with people that I love, and help is not even a little yelp away, right? If I need support from my husband, my kids, I have a lot of support. I do. We've grown a village. So that part is to, yes, this is hard, but right now I'm not being threatened. And really, really in this moment, neither is she. This is just difficult to watch. It's difficult to experience. It's all the same pieces. The self-compassion piece obviously is huge. I will tell you what's worked for me too in those moments is having because she has these episodes. It's a little difficult to explain. I think it's specific to her gene disorder, but and it's usually in the evening. And so I always set something up for myself afterwards that I can focus and think about then. It could be anything, but it's not pedicures and manicures. Okay. It's like, I already know I was looking forward to reading that particular book with that author, because I remember she talked about this. That's what I'm going to do. I believe really strong in the power of salt. I don't know if you've heard that mechanism where it's like tears, ocean, it's like the tears, ocean, and
And sweat.
sweat.
Yeah.
Yeah, it's like that's healing. Okay, well, I don't feel like exercising right now, but I tell you what, I bought a really awesome bag of Epsom salt that smells like eucalyptus. And when this is over, when she has gone to sleep, I don't care how late it is. I don't care if it's 2 in the morning, 4 in the morning. I am going to lay in my salt bath, right? And I'm just going to be grateful that it's over. And tomorrow the sun will rise again. And it might be a better day. I don't know. So it's literally having to find the places where you don't feel safe and figure out what's going to make you feel safe. Find the places that are uncomfortable and what's going to make you feel comfortable. Finding the places that are impossible to bear and what's going to make that bearable in just the present, right? In just that present time. Never have the words step by step and moment by moment been more true for me than in my life with my daughter right now. Um, we it would be completely worthless and not helpful at all for me to wake up every day and think, oh my God, is this her last day? Is this the day that they tell us it will probably be stroke or seizure, that will be, fatal in the end? Is this the day? I think we've had such a different perspective shift in that every day it's almost, we view it like the first one, right? Like instead of the last one, like just such an appreciation for everything, for the fact that, today she did feel good. Today she was cooperative. Today she was, it's a lot of celebrating such tiny things. And I think it's pretty cool that my other kids see that too, and that they take notice, of what that is, what that looks like.
Yeah. I like thinking about this question of what does support look like?
Yeah.
And like you said, yeah, absolutely. Physical exhaustion and being pushed to the edges of what you think is physically possible for you, especially when it comes to like interrupted sleep.
Yeah.
I can't overstate how
Absolutely.
much that impacts just your
Yeah.
your physical functioning. But also, what supports do we need for the emotional and the mental side of things?
Yeah.
Because the the mental exhaustion is real, also of
Yeah.
keeping all the things in place that need to be kept in place, and keeping track of the meds and the doctors and the specialists and the appointments and all of those things. But I was thinking about this question of, in those moments, what is available to us?
Right.
What do we need in those moments when you are sitting in a dark room next to their
Yeah.
bed
Yeah.
and feeling like you might drown
Yeah.
in the worries and the exhaustion and the fear and the anger and the sadness. And I think it boils down to that in other moments we learn how to tolerate the discomfort, and it's the phrase that comes to my mind a lot is, everything is temporary.
Yeah.
And so I've told myself
True.
that in the moments where things are really bleak and I'm feeling really, really low and down, is I can remind myself, like, okay, do you remember yesterday when you didn't feel like this? Okay, tomorrow you're going to have more times where you don't feel like this. And so if I can sit with myself very gently and see that part of myself that is really struggling and really having a hard time with it, and say, like, I'm right here with you. Like maybe that sounds weird to like talk to yourself in that way, but like anybody who's interested in exploring this technique a bit can look into internal family systems, and this is where like the self-compassion comes into play, where I can see myself trying so hard to keep everything together and to make sure that everybody's okay and make sure that I'm okay.
Yeah.
And just drench myself in compassion and kindness and say, yeah, like, okay, yes, this is so hard. And everything that you're feeling right now makes so much sense. It makes perfect sense.
Yeah.
And I'll sit here with you as long as it lasts.
Yeah. I think the other big piece of this, as you're saying that, it reminded me, another big piece of this, a lot of the work in the beginning, this was even before I went into getting a master's, just the personal work that I did in the beginning, it all started with self-compassion. Kristen Neff I'm sure you're familiar with Kristen Neff. She's brilliant. I've read her books, and that's where it started. But then I went to Tara Brach, I believe it's Tara Brach, with radical acceptance. That's a huge piece. That's a huge piece, because if I could tell you what I've learned about radical acceptance in one sentence, is that I do not have to define something as good or bad. I can define something as is. This just is right now. This is not terrible pity party, woe is me, oh my God, nobody would ever be able to handle this. Why was it's not that. It's also not, what a blessing, I'm going to learn so much from this. My kids are going to grow. I'm going to be an incredible human. This is going to make me grow as a person. It's none of those things. It is saying this is just the way it is, because life in itself is a paradox, and it's going to have both. And living your fullest only means being able to live amongst it, both of them together. And so radical acceptance has been a huge piece for me. And I will say that while I think the healing journey is ongoing, I think I've come to a really good place in understanding radical acceptance, and practicing that, and feeling like that's real and tangible for me right now, which I didn't believe that a couple years ago, but I'm getting to that place now. And that has also been a big piece that I think, is important to talk about. But you mentioned earlier, and I think this is also kind of interesting, and, we've asked this question before, is understanding that there are so many caregivers out there, understanding they need support, understanding, right? Who's responsible? Like, who's responsible for caring for these people? Who is it? Is there somebody who should be identifying somebody who's in crisis? Who should be asking the questions? Who should be the ones that are, doing the preventative care? We talk a lot about preventative care. Healthcare is full of preventative medicine. So if we already know that people are going to go through crisis, we already know that, right? Where is the preventative medicine? Where's the prevention aspect? And not only that, once somebody is in crisis, at what touch point should that have been examined a little bit more? I've gone through these questions a ton. Obviously, I've been through so many specialists at this point. I can't even keep track. I have to go on my chart to read you all the names. We haven't had a single physician ask me about me after giving a completely devastating diagnosis and them understanding what that means for our family. And I want to reiterate, I, I have a doctorate too in myself in healthcare. I think all of our doctors are incredible. They're amazing. We have an incredible team. So for a while I thought, but why didn't anybody ask me? Why didn't anybody ask what resources I was looking for, if I needed resources, to offer therapy to me, to ask me, why not? Why not? Right? And then I thought about my primary care physician. Most women don't have one. But I thought about that. I thought about my OBGYN. Well, I mean, we go to them once a year. Are they supposed to take care of? I would go through all these steps of like, where is the touch point here? Not just who's responsible. Remember, because that's the opposite of the whole self-reflection thing. This is like, whose fault is this, for not taking care of me? But also, from a healthcare standpoint, wanting to make a difference in that preventative care, right? What can I do to make sure we have that preventative care? And I think when you get to the source of it, we are responsible. I think that we have to have enough self-awareness, even not knowing what that is, to understand that what we're feeling and experiencing is not the norm, right? This is different than the way I used to be. This is impacting my relationship with so-and-so. This is changing the way I feel about my life. This is changing the way I parent. This is not right. When all these things start to go down in a negative way and not what you want and not, I think that we have a huge responsibility to be able to seek help. And that is where I come in, right? Where therapists come in being able to have programs that are specific to those people and specific to that kind of help that's needed, that kind of, maybe not preventative care at that point, but yeah, I don't know. And I say it's on us because I think even if doctors ask, how many times do we lie? So a great example of this is, I put this together a little bit when I read that research about the telomeres, remember, and about health and like, oh my gosh, I'm already at risk for all these things. It was no surprise to me after reading that article that I had breast cancer at 35. I was 35 years old. I've had a bilateral mastectomy at 35. I have no gene markers for breast cancer. I've had a couple people in my family, but no genetic predisposition to it. So I actually go to MD Anderson every 6 months. Well, guess what they ask me every 6 months? There are 20 questions about, am I depressed? Am I crying all the time? Do I feel like there's a threat? Am I under a lot of stress? Yeah, every single answer is 1,000. And not because of breast cancer. I was able to catch it very early and, it's been years now. But how do I answer that? Yes, that is the truth, but I would rather not be, inpatient today because I answer yes to all these things. Like, right. So that's why I say that. It's not because I don't think that doctors can have a role. Obviously they can, and they do. But eventually it does reflect back on us. We are responsible. At least not maybe for knowing all the answers or knowing all the coping mechanisms or that, but at least identifying when something is a crisis, when it is a crisis enough that it's changing who we are, changing how we feel about the world, changing our motivation for having the roles that we used to love so much and take so much pride in, all those different steps. And I don't know at what point you teach that. I don't know. Is it a role of a parent to teach their kids, hey, in your life, things will happen. Here's how you can identify when you need more support. I don't know if that's something that needs to be in schools or if it needs to be, like you said, in those classes when you have a baby. Yeah, I'm not sure, but I know that the statistics are huge. P.S. We expire. I think you said it on one other podcast that like 100% of people will die. Like 100%, everybody. It's the best statistic ever. It's just the truth. And so I think that how do we not already have something in place, to prepare our kids, to prepare? In fact, I think a lot of these topics are real taboo. You don't want to talk about death. You don't want to talk about, sickness or illness. That's so negative. That's so negative. Why would you, want to talk about those things? We have found it to be the complete opposite in our family. And I think actually really empowering for my kids, to be able to have conversations like that. And so more than I think, Isla's life, I know, is going to serve so many purposes, for so many purposes and so many, what's the word I'm looking for? There will be so many pieces of the legacy that, that she
Mhm.
leaves when she goes. And I think one of those pieces, it's not so much about her siblings wanting to fight for disabilities and being advocates. And, I really think because of her life, they will be so seasoned in how to handle crisis. And gosh, how could you not be more um, grateful for that? She
Mhm.
was the starting point for me as a mother to be able to even have those conversations, in a way that was controlled and safe, and with the education behind it. And so, yeah,
I want to circle back to what you said about where are the gaps in support?
yeah,
Where, because your experience with sitting across from medical specialists and having them deliver this news, and then you leave the office and you get on the elevator and you're like, what? Like, what just happened? And not just what's next as far as like the physical care for my child, but like for me.
right,
And I am, and it's been 11 years now since her diagnosis.
yeah,
And I can't think of many times, if any, where these medical providers were asking me
yeah,
how I'm doing. And I'm totally on the same page as you. Like I have had so many amazing, wonderful, compassionate, knowledgeable doctors,
yeah,
and so I don't think that it's for lack of
sure,
true care and a true sense of connecting with another human in the room. But I do think that there are some serious problems systemically that contribute to this issue. And as I was considering, like, what could that look like? The two things that popped into my mind. One is we have to have examples of what optimal mental health looks like. Like there, it's because otherwise we can fall into this kind of trap of thinking, well, yeah, what I'm feeling is normal, right? And it's not until we can see a spectrum of what well-being looks like that we can say, oh my gosh, like this is actually available to me. Like I'm taking a positive psychology class right now, and we had to take this test on like what level of happiness are you at, and it really wasn't about the happiness, it was about like overall well-being.
yeah,
And we were asked to share in these discussion posts what our scores were. And one woman said, this is my score, and I wasn't sure how it compared to other people. And then someone else said something that I thought was a really amazing way to think about this. She shared her score, which wasn't like super low, but it was kind of low. And she said, that makes me feel hopeful because it means that there's somewhere for me to go up from here.
mm,
And that's what I feel like, if we can have honest conversations about where we're at, or we can say like, this is where I'm at now, but this is where I was at 5 years ago,
yeah,
and what things helped me get to where I'm at now in my sense of well-being or wanting to be in my life.
yeah,
That's what people need to see, because they need to
sure,
see what's possible for them, and that you're not just stuck in a life that's like, well, I guess I just have to grin and bear it and get through it. But like, that joy is still possible,
mhm,
even in the midst of tremendous heartache. And
yeah,
here's how that can happen. And the other thing that occurred to me was like just the very weird time that we're at in our human evolution, where we are so siloed. like there's a great book that I recommend to like all the people to read called Being Mortal, where Dr. Atul Gawande talks about how weird it is that we have only just like one generation or two generations living in our homes now. Like it used to be elder care
Multiple,
was
yeah,
right. It just
yeah,
they all lived in the house together, and it wasn't until like nursing homes or assisted living facilities are
yeah,
new.
yeah,
These are new things
right,
in human history.
yeah,
And so one of the problems that we have is that we're not around death very much.
yeah,
If we think about even just our food, like I go to the grocery store, if you're a meat eater, you go to the grocery store and you get a steak that's packaged up in the styrofoam and the plastic, you don't see the animal that it comes from. You don't see the process of
mhm,
it. And there is such this sterilization of the life cycle and such a distance from the life cycle that we're not learning from each other how to be okay with the life cycle.
yeah, yeah, with things that will happen in life, no matter
Yes.
what. Yeah, I don't know, and I don't know where that started or the evolution of that, but yeah, I agree with you. It's this, it's like wanting to protect our children or protect ourselves from
Mm.
things that are hard or inevitable. Which think about that, protect yourself from the inevitable. That's so opposing. You can't do that.
Right.
So like, that's wrong. You should be prepare for the inevitable, not protect them from the inevitable. So yeah, I can totally see. I can see your point of view on that. And then to touch on what you mentioned about how, yeah, what does that look like? I think that's
Yeah.
for a lot. I will tell you what's worked for me so far is, yes, understanding, doing the work and, all of the self-reflective pieces and self-awareness, reading and stuff like that, which everybody can do in different ways. Not everybody loves to read, not everybody loves, but everybody can go to therapy and try to find a good therapist. But if I'm looking for ways to tangibly help people, right, I will tell you that in the nonprofit work that I've done, even though it got to a point where I did need more and it wasn't serving me from a mental health standpoint the way I needed it to be, um, there was still tremendous power in a group of people that are
Mm-hmm.
sharing the same experience. I've never seen anything like it, and I've never experienced anything like it in my life. And the very first event that I did, when I started my first nonprofit, was just by myself. I don't know what I was thinking, but I was just so desperate for this connection piece. It was like 60 women in a room. I grouped them. Remember, this was just the autism component at that time. So it was 60 women in a room. All of them had a child with autism. I grouped them by age and gender of their child so that they would have,
Mm.
an even greater level of connective pieces at that point. It was powerful beyond, I mean, within the first few minutes, the emotion, the vulnerability, it was just built in. Honestly, I would have been able to invite them to that room and not do anything else, and it would have been the exact same thing. They did not need decorations. They did not need me to go on a pretty stage or have music or special speakers. They did not need that. They needed each other, because I think that there's two big pieces with that. Number one, remember that it really serves that self-compassion piece of, man, I am really not alone in this. In fact, that story is crazy. Like, what, it's just and then that's the self-reflective piece. Like, okay, let me reevaluate my situation. Not really comparative, but I think helpful in not feeling so isolated and feeling connected, and understanding that even though a lot of things we have to do are alone, we have to do some things alone, right? But
Mm-hmm.
loneliness is really defined by the quality of the relationships around us, not the proximity. It's the quality. So if I can give them those experiences, right? So I've seen that happen. I've also seen how that exact same group can derail itself quickly into commiserating and misery, and without a leader, without someone who's really identifying different connection pieces and really making you know draw out different feelings, draw out different things you're saying. And so that's where I became really interested in group therapy. You don't hear about group therapy a lot. You hear a lot about support groups, which are different, right? A support group doesn't have to be led by a therapist. It can just be people, kind of like what that is, right? Just gather people and they support each other. But I mean like a real therapy group where people and perspectives are challenged by a therapist who can really get to those spots that are going to really help you grow and teach those tangible tools in those hard spaces. And so I'm doing a lot of research in that because I'm finding it's really hard to get women into a group on a consistent basis,
Hmm.
especially a mom like me who is a 24/7 caregiver to a little girl with disabilities. So there's still a lot of questions to answer, right? How do you do that in an effective way? How do you do that? Because I know that's part of the answer. I know it. I've
Yeah.
experienced it. I felt it. I've been in those groups and left completely changed. And again, not in with this new diagnosis, but I think that's part of what I'm looking into next. And how does therapy play that role? How do we make this accessible to more people? Obviously there's telehealth and you can do, telehealth, Zoom groups or, whatever, but with a therapist, managing it. I think people would prefer in person, but if that's, too hard to do. So I don't know. Is it retreats? Is it more retreats? Is it more events? Is it more, what is it that would get more women like me to a place where it was accessible for them to learn these things and have experience in this way? And does it have to be ongoing? Can it just be the
Hmm.
focused brief therapy groups where they're 6 week sessions and just trying to give you tools for this, 8 week sessions? When I think back to that day, when I got that diagnosis, whatever, I really think that if someone said, hey, there's this lady who's actually lived this life and she does this group every so many months. It's a 6 week thing. She teaches, all of the ways, the challenges this year might give to you. And I think I would have done it. I would have been like, okay,
Hmm.
well, I'm gonna try. I'll just see. I don't know if I'll like her. I don't know if I'll, if it'll be helpful, but shoot, it's something. And so I think that's my goal, is just to have something like that available. I don't know what it looks like exactly yet, not because I don't know what I want it to look like, but because I want it to be accessible, readily
Yeah.
tangible for most people, for the majority, to go from that. And then I think the other part of that, so there was two parts. One is that power of group in how, that it really, I think, draws out things, or it puts you in a position to be really heard and understood in ways that you haven't before. But the second part of that is that I've learned now over the last 3 years, we're going on 3 years in the next couple of months since this happened. Um, Grieving and grief. I first found out that it was called ambiguous grief, which is a whole different episode. And there's some really powerful movers and shakers in the ambiguous grief world, online and on social media. Ambiguous grief just means, missing someone who's still here, grieving somebody
Hmm.
who's still here. And this could be anything. It could be a divorce. It could be, an estranged parent. It could be, it could be a caregiver with a parent who has dementia and now it's not the same person. So they're grieving, this relationship or grieving that. I have found through that the biggest connection piece and the aha moment for me is to understand that I wasn't just grieving her life. I wasn't just grieving the daughter I had or the daughter that I may lose. I wasn't just grieving that. I wasn't even grieving a relationship because we already had a pretty different relationship with her autism and intellectual disability, right? I had already felt all of those things early on. I think I was and still do grieve the version of myself that existed before this.
Hmm.
That's a big thing to identify, you know? That version of me was really different in so many ways.
Hmm.
I do not feel like the same person. I don't think anything has changed me in my life more impactfully and wholly than just the last 3 years. Even though I thought I was already, right? From her disabilities, it wasn't. It wasn't at that level. And and there is a grieving about that. I miss that lady. She was a little different, you know? She had a different social life. She wanted a social life. She had different relationships with people. It was just different. everything changed for me. You have it in your, the best thing I can think of is in your intro to your podcast. You say that you're highly allergic to, I think, what is it, superficial conversation or surface
Yeah.
conversation. That is a huge thing for me right now that I struggle with maintaining, particularly female friendships, because I just crave something more. I'm so tired of
Mm-hmm.
being in the shallow. Like I want to go deep. I need to have big, deep conversations and have connection at that level, because what I'm going through is big. It requires a different level of friendship, and I find myself um, really seeking that out and not compromising, but changing the level and amount of energy and time that I put into relationships that I know will not give that to me, that I know will not fulfill me in that way. And I think that's something that women need to hear too and talk about. So when you talk about this group therapy piece, there's so many components. It's not just about how do I physically take care of this child, or how do I get over this emotional toll. You're talking about the social construct of never be able to go to dinner again and have a normal conversation, like ever, because it's not the same, you know? Because what's the first thing they ask you when you go to dinner with a new couple? Say you're going on a double date and you've never hung out with these people. What's the first thing they probably ask?
They ask about your kids.
They ask
You have
about your
kids.
kids. Yeah,
Yeah.
like, how many kids do you have?
Hmm.
And real quick, you're like, oh, how am I going to do it? I don't want to do this here. So you're quick with your answers. I have three. How old are they? Uh,
Uh-huh.
yeah, they're 16 and 12 and 8. They're all 4 years apart. I make a joke about the Olympics and the presidential elections every 4 years. And, it's the same thing. It's the same, right? Because
Yeah.
I'm trying to lead the conversation away. But then sure enough, it almost never fails. When they hear I have a 16-year-old, what do you think they say?
Mm-hmm.
Oh, she must be a handful. Are you having problems with boyfriends already? Are you getting into the dating, whatever? And then you're stuck, because it's like, if it were me, if I were this person, I would want the courtesy of knowing your truth so that I don't keep digging myself in this hole, right? It almost seems disrespectful to not tell them how different things are for us, because it's tough, right? But then if I tell them the truth, one of two things are going to happen. They're going to have so much pity, right, that it's not going to be an enjoyable conversation after that, because they're just going to feel so bad for you, which is a different thing, right? Or it's going to turn everybody off. And some people don't like that level of discomfort. They just don't. They're not comfortable with those things. And I don't blame anybody for that. I get it. But we're at a dinner date, right? It's supposed to be a fun
Mm-hmm.
time. I don't want to hear about your problems. You know what I mean? And so I typically land on telling the truth in a very quick and matter of fact way. Sometimes it gets awkward, and there's that kind of little awkward silence. And my husband's like, "Can we get more bread? Can we get more wine?" You just gotta kind of change the vibe. But again, nobody talks about that. No one has ever had a conversation with me about how difficult that is, and that how you're trying so hard to fit into two different worlds. The reality is just so wildly changed for you that I couldn't possibly, respond. One of the complex PTSD, one of the or one of the diagnosis, or I guess one of the symptomology of it was, a lot of jealousy and a lot of anger. It's like when, I felt that a lot about myself, and that's not who I am innately. And so when I started feeling that way, that was one of those signs that I was like, "Ooh, this is not feel good. This is not who I am as a person." But when you hear small things, like, "Oh my gosh, I'm so devastated because my kid got a B and not an A," and I'm like, "Really?"
Mm-hmm.
And again, that's not fair. That's their reality. Oh, my little girl, she didn't make the cheerleading team. We're devastated. And I'm like, devastated? I can tell you what devastated is, right? And I'm saying that in a way that, that's not the way I want to be. That is not the way you should think. But that's how I was thinking. And so it was very difficult for me to have almost any conversation. Morgan, how do you have any
Mm-hmm.
conversation with a mom without feeling like, do you even understand? And
Yeah.
so that was that was a big, big red flag for me when I knew, because that's not how I was. I love all of my friends. I love to celebrate people. It's part of what I do. I love, those things in my life. So feeling that way does not feel good, but it's also not talked about a lot. You should be grateful for your life. Don't you feel lucky to be Isla's mom? Don't you
Mm.
feel lucky that you were chosen, for this path? And I think people have a lot of expectation about that because mothers should be. They should, no matter what's given to them, no matter what life brings them, you should love your kids as they are and be happy you have three. Some can't have any. Be happy it's not this. Be happy it's not, it's all that stuff that I think you can only safely talk about in the construct of a group that is experiencing that same thing with you. And I think there's healing in that. And the last part of that is because I know now that grief and grieving has to be witnessed. It has to be witnessed. It's not about anybody having an answer. You could be in that group and not a single person would have a way to help you. But witnessing the grief is so important. Being able to say things out loud and having people hear you and experience that with you, um, I think that's one of the most powerful tools in grieving is just for it to be witnessed by other people. I need you to see it too. I need you to hear it too. Not because it fixes anything, but it absolutely it diffuses the grief right
Mm.
into this group where you can tangibly feel like people are feeling for you, like they're understanding with you. There's that kind of that's a physiological change that I haven't yet to explain, but I probably will find the education
Mm.
behind that. But it's so true and it's so real, you know?
I thought about this recognition of these parts of ourselves that we don't want to be there, like the parts of ourselves that get jealous or short-tempered or angry when other people say things. And this is a primary example of times when it is essential for us to practice self-compassion, because
Yes.
to ostracize that part of ourself that's feeling jealous
Right.
is to miss
That's
what
right.
the jealousy is telling us about a yearning and a longing for a connection, for things to be different.
Sure.
And I wonder if the more we exercise self-compassion and self-love in those moments and for those parts of ourselves, that we can become more brave to say some of those things to women when they're saying things like, you should be super grateful for this, and that you can say, yeah, sometimes I am, and sometimes I'm
Uh-huh.
just so angry.
Yeah.
Because I suspect that a lot of times we say the thing that we're supposed to say
Mm.
to represent how we're supposed to feel, but
Right.
that we don't actually, and
Yeah.
so in those moments where I could tell another mom, like, like I remember, especially, oh gosh, especially when my kids were super little and I'd be at the grocery store and someone would say, oh, it goes by so fast. And in my head, what I was thinking was, I hope so, because this is so hard. This is, like, I can't wait for these days
I
to be
can't
over.
wait.
And these cute little old ladies that are like,
I know.
cherish these moments.
I
And I'm like,
know.
no, these
Yeah.
are off. This is so hard. And it's like, I wonder if when we get more sure that there's no parts of ourselves that are bad for feeling the way that they feel, that the generosity in our honesty about how things are going then opens up portals of connection with other people in a way that we didn't know exist. But
100%.
I completely empathize with you with talking with people about our kids, because I'm in the position of having three but two kids, where people, how many children do you have?
Yes.
Yeah, I have three but two. How old are they? Well, would have been 17 but 14,
Yeah.
like this type of
Yeah.
thing where,
Yeah.
I mean, I guess not 17 yet, but 16. That it just is like, what do you say? And I frequently want to offer to people who are in those positions some things that they can say.
Right.
So if you're the couple that's sitting
Right.
across the table from a family who, you're like, crap, what do I say right now?
Right.
A really great thing to say is like, would you like to talk some more about that? Or tell me what you love about your child or what you love about your children. Or, and open up an invitation to talk about it more if they want to,
Yeah.
but to signal that all of us are feeling uncomfortable right
Yeah.
now, not
Yeah.
this, the couple that was surprised by
Sure.
this information, but
Yeah.
and I think the invitation to be in the discomfort together is such a powerful thing.
Yeah. And we have found, I know me and my husband, um, in the end, we have found that it leads us to the greatest of friends.
Yeah.
It's the number one way, honey, to figure out who's gonna stay and who's gonna go. And
Mm,
that's not on purpose. We don't do that on purpose, but like it really is. And there's been some that stick. And I have found that the ones that stick are usually the ones that know what suffering is.
yes.
They just know.
Yeah.
And that's, or if people do know it, they haven't maybe even addressed their own, right? Because there's that part too.
Mm,
But no, I think we've taken a lot of that in stride and understood. I think a big part of it too, what's helped me too, is to understand that this is not normal. I think for a long
mm,
time we get stuck in that this is just my norm, right? This is the norm. People would always tell me, well, you're going to get used to a new norm, right? Like the diaper situation or whatever. And then it's like, I had this little crisis the other day, a little existential grief crisis when I was bathing her and I was thinking, I don't even remember what it was like to not bathe her. So what am I even grieving? Right? So what I'm saying is there's so many steps in this. There's so many steps in the whole grieving process, or thinking about those things. But yes, but we were getting back to sorry, I lost my train of thought, into the friendship component. I don't know where I was going with
mm.
that, with the grief
Yeah.
part.
I think that's
The
it's an apt way for us to talk about what some of the loneliness looks like,
Yeah,
and some of the lack of support is, just the challenge, some of the very normal challenges of like
sure.
creating adult friendships is sometimes, just complicated so much physically, mentally, and emotionally when you have additional circumstances that
Right.
just make it a real challenge to do
Yeah.
that.
Yeah. Nobody teaches you how to do that. Nobody teaches you how to
Mm.
teach you how to be a mom. Even then, you don't get taught how to be a mom, right? But it's very difficult to to be taught. I had a friend who it stuck with me so much, and I think about you too, because you've already had your daughter pass, and she said, I already knew I had learned how to become a mom. She had a child and then had a very late term pregnancy loss and was struggling. And she's like, by that point, I knew how to be a mom. I had learned how to be a mom to a living child. I don't know
Mm.
how to be a mom to a child who's not living. I don't know how to be, and it's like, again, this situation where you have to really get used to so many different versions of motherhood and what they look like in you. And then, I think that's where I was going earlier, to find friends who'll be willing to reconnect with that new version of you, to find friends who are going to say, okay, things have changed for you. All right, let's learn the new you, let's learn about the new you. And so I talk a lot about how we talk about accommodations and how Isla needs so many accommodations for accessibility. I actually need a lot of accommodations to be my friend. I just do.
Mm.
We do, our family, and so when you find people who are willing to do that, yeah, you hold on tight. And I think there's a misconception that you need a bunch.
Right.
You don't need a bunch. It's just a few, and you start to find them. You start to find them, but to your point, only when you share at that level, right? When you're
Mm.
willing to say the hard things and go to those places with them. So yeah, we'll
Yeah,
see.
and when you're at a place where you can handle that too. Like I've had to be okay with sometimes telling people I have two kids, because I know in that moment, like, I'm not in a place where I can
Correct. Yes,
answer more questions about this. I
that's
just
right.
don't. I can't. So it's okay
Yeah,
to it's
yeah,
okay to deflect or to
sure.
steer the conversation somewhere else if you recognize where you're at in your capacity to go there with people.
Yeah, and I think it's okay too to be the opposite side of that. That it's okay to be selective, on
Mm-hmm.
on who you choose to have those conversations with, or deeper conversations, or deeper, right? Some people are not really, they can still be friends, they can still be acquaintances, there can still be those interactions. We just have to know that. We have to have a self awareness enough to know I can't go there with them, right? This night
Yeah.
is going to be about this, it's going to be about that, no matter what happens. And so I think that's also not really self preservation, but I think that's respectful to ourselves too, right? So that we
For
only are
sure.
able to share in spaces that will also hold space for us, that it's not going to be, and that's also a self-compassion piece, right? In caring for yourself and understanding that it's not that I'm going to lie, I'm not going to be inauthentic, but I'm going to protect this piece, because I don't think
Yep.
that this is a space where it's going to be accepted well, or maybe even accepted at all, So I think that has been a struggle too, is understanding that being selective doesn't mean inauthenticity,
Mm.
right? Being selective in what I share doesn't mean that I'm being fake, doesn't mean that I'm not telling you the truth. I think that's the way I practice self compassion for myself, and for my family, and all that we're going through. So,
I love that. Well, before we wrap up, is there anything that has come to mind that you feel like, oh man, I don't want to forget to say this thing?
oh gosh, I don't know.
I mean, I think we did a pretty good job covering all the
There's a
things that we
lot.
intended to
Yeah,
talk about.
there's a lot to this life, and there's a lot to. I think, I don't know. I think that I connected with you in the beginning. I think because of this quest, or this journey in really wanting to learn and understand and educate ourselves about what has happened in our life, what has happened to our bodies, what has happened to our mental health, what continues to evolve and change. And I think that's really encouraging for people to understand that education and learning can be the most helpful, impactful, healthy coping mechanism that you can choose in almost every situation. As a healthcare provider, some of the most frustrating moments have been when patients will say, "Well, you just decide." Right? I don't know what you
Mm,
know. I don't know anything. You just tell me what medicine to take and I'll take it. You tell me what to do and I'll do it. And while there is a place for that, and there's also some psychology behind that, right? Because I take care of veterans who take orders for most of their life, and there's a lot behind that. But um, or even, let's say, somebody who gets a diagnosis, a friend or whatever, and they're like, "Oh, I can't even read the report. I don't even want to know." That always is so tough for me, because to me, in order to be an active participant in your own life, in your own decisions, in your own care, you have to know. You have to educate yourself to the max that you're able, to the most of your potential, right? Intellectually or academically, whatever, um, to show up for yourself, like for yourself. And so, regardless of what comes our way, whatever crisis, whatever tragedy, whatever that comes, um, I believe that learning and education and imparting that knowledge to others is going to be what saves me time and time again. They have that analogy of when you walk through the fire and you go back with the buckets of water.
mm,
I've always felt called in that space in a lot of different realms in my life, and I don't think this will be any different. And so I think I'm grateful that I've chosen those coping mechanisms, because I know there's many more that would not have served me well and would not have been the best choice, for me and my family. So I'll continue to devote this next chapter and this next act um, into helping people like me figure out what coping mechanisms in their life are specific to them and specifically serve them, right? Because they'll be different than mine. And doing that investigation, and that, being curious and being creative in the way that we do that together.
mm. I love that. For everyone who's listening, I will put links to all of Lisa's things in the episode notes. And I just want to say, just take care of yourselves, everybody. Be your own best advocate for your mental, spiritual, physical, emotional life. And when you find the things that work for you, ferociously protect them as part of your daily habits and your daily routines, and because you're the only person who knows what it's like to live in your skin. So find the things that work for you and stick to them. And before we go, P.S. we expire.